This June marked the 13th consecutive month of record high temperatures. Heat waves are a major threat and can make existing health conditions worse, putting lives at risk. A leading health solutions company launched an environmental health impact initiative using real-time data to proactively support vulnerable patients. Now, Dr. Necht, a practicing physician, Vice President, and Chief Clinical Innovation Officer for CVS Caremark, is here to discuss this initiative. Good morning, Doctor. How are you?
Good morning, James. I'm doing well. How are you?
I'm doing great. Now, we're seeing especially high temperatures across the country right now. And we know hotter temperatures can be challenging for people with chronic conditions. Why is the Environmental Health Impact Initiative so important right now?
Absolutely. So more than a year ago, we embarked on a research initiative. We really wanted to understand the impact the environment has on patients. And so one key insight we surfaced during our research was that heat waves kill more Americans than any other serious weather event. That includes hurricanes, tornadoes, floods, fires. And this happens year over year. The good news is these deaths and suffering associated with heat waves is largely preventable with proactive and preventive actions. And so that's what's so important about our environmental health impact initiative. We're trying to get ahead of these serious weather events and warn those folks who are most vulnerable.
Now, what is the Environmental Health Impact Initiative all about?
So the initiative brings together data and an empathetic clinical staff to help those people that are most vulnerable to heat waves. So this is how it works. We pull in weather data, so heat, humidity, air quality data, and we pair it with our analytics machinery to identify folks in our Aetna Medicare Advantage population who have health issues or socioeconomic struggles, who are at highest risk for poor health outcomes related to a heat wave. And we pipe that information to our registered nurses who make proactive outreach to these folks via telephone up to several days prior to the arrival of a heat wave in that community. And so our nurses engage in a individualized, rich conversation where we educate these folks, but also put in place a health action plan to keep them safe.
Now, how does it work and how do you identify patients and how is outreach carried out?
Absolutely. So we take advanced analytics and we look at health information, demographic information, and that weather data, and we risk stratify. And so when we have that population of folks who are at the highest risk, our care managers call them and then they have a conversation. They inform these folks that a heat wave is coming and educate them on the signs and symptoms associated with heat exhaustion and heat stroke, and also discuss the unique circumstances of that individual. Do they have an air conditioner? Is it working? If not, let's give you resources information and resources to get to a cooling center, for example. If that person has a pet, let's put in place a plan to keep those pets safe, right? A lot of medication can interact with heat or the body's ability to react effectively to heat. So providing that information and personalized context is just so important. Ultimately, the plan is to give these folks the resources and support to keep them safe as it relates to that incoming heat wave.
Now, what types of resources do patients have access to?
Absolutely. So first of all, personalized knowledge that's relevant to the individuals. Secondly is information on local cooling centers. And third is putting in place actions that can keep that person safe. So staying indoors throughout the day and changing behavior. So going out only in the morning or at night, making sure the individual is appropriately hydrated, and also checking in on neighbors, right? Heat waves impact everyone, and so this is an opportunity to keep neighbors and other folks at risk safe as well.
Now, during heat waves, there are tips and information that people should keep in mind. Can you share a few of them?
Yeah, absolutely. So I think first and foremost, it's staying hydrated. It's knowing the signs and symptoms of heat exhaustion or heat stroke. And then 3 is making sure you have a plan to get to a cool environment, whether it be making sure your air conditioner is working or access to a cooling center. And then finally, Mental health. There is an association between high heat and mental health challenges. So, for example, our care managers will have a conversation about mental health, and in the event one of those individuals is struggling with a mental health challenge, we're able to connect them with clinical resources and support to help them through that as well.
Now, who is eligible to participate in the initiative?
Sure. I'm really excited to say this is a program that's nationally available for Aetna Medicare Advantage members at no cost. Also, what's particularly exciting is we're rolling this out beyond just Aetna Medicare Advantage. We're going to be using CVS pharmacists, Minute Clinic, and we're thinking beyond heat waves in the future, right? Poor air quality events can cause people to have asthma exacerbations or a cardiovascular event. So being able to reach out to folks as it relates to incoming poor air quality is something we hope to roll out in the coming months. And then I'll just finish by saying I'm a doctor. I still practice medicine. It's just so rewarding to know that CVS is rolling out this initiative and keeping people safe from these serious environmental threats across the country.
Now, Dr. Neck, where can our viewers go to learn more?
Absolutely. Learn more at cvshealth.com. The CDC, the Centers for Disease Control, also has good resources online, and I recommend people check them out as well.
Well, I got one last thing for you, Doctor, and that is, I'm embarrassed to say this, but just a couple of weeks ago, I suffered a situation where I was dehydrated, had to go to the emergency room, was in there for about 4.5 hours while they pumped me with fluids. And I exercise, I work out, and I wasn't drinking enough water, and I wasn't putting enough electrolytes back in my system.
Exactly. Got to stay safe, James. I'm sorry to hear that happen to you.
Well, I learned from it, and trust me, I drink a lot of water now, and I get a lot of electrolytes, so I've learned my lesson. I really appreciate talking to you today about this particular subject, because it did affect me, and I know it affects millions of others.
Thank you, James. Appreciate the conversation.
Thank you. I do too.